Hello, this is a second part of the video, the unit 425, the nervous system 1. A. Sensory loss. The central nervous system controls the sensory or motor function of the body. Disorder of this system therefore lead to loss of some of the function. Function loss, other symptom. Function here since sensations or feeling, balance loss, dizziness, bleakness, numbness, odorlessness, and other buzzing or ringing in the ear tinnitus, double vision, diplopia, blurry loss of vision, acute clarity of vision, thinly open or nasally parasites, dizziness, vertigo. There are no common words for loss of or conditional relative to taste as smell. Motor loss. Motor loss symptoms of seeing include weakness, loss of power, paralysis, complete loss of power, tremor is voluntary rhythm, move especially of the hands, abnormal gain, unusual manner of walking. Sleep may also be affected, for example, hawking sickness around this voice, as is vocal voice cord parasites, cerebral full articulation, as is cerebral disease, loss of consciousness. Patient may describe zonal loss of consciousness in a number of ways. It's a passing out, and had a black out, a fade, I had a feeling, I had a sense, I have a convention. Feel or intuition or convention are all used to refer to violent, involuntary movement as epilepsy. Doctor may be when they lost consciousness. Here, pay from test of the case of lost consciousness. The principal differential diagnosis is between epileptic field or syncope attack of fatally syncope is a zonal loss consciousness that during to temporal phase of the cerebral circulation second or distinguished from insuppressible by consent with the events occur. For example, psychosis occur will standard other situation or severe stress or association with anthemia, sometime or convulsion or urinary continue. Loss of control. Loss of control of the bowel of the bladder occur even in a single attack. During in neither of these, especially specific for epileptic attack, they key to stability, the presence of same or pronounced symptoms or symptoms that occur immediately before they attack. Syncope disorders are usually present by symptoms of this sickness. Leave either in epileptic people may get a waning now as a aura that an attack is going to happen. Is going to happen. nervous system, the motor system. Examining of the motor system about should include a segment of the following: muscle buying and armor of muscle tissue. Look for seeing or weighting muscle atrophy. Muscle tone at hormone of tension in a muscle when it's relaxed. 2. Can be increased spasticity or discrete flexibility. Muscle power stress. Conditional the ability to use several muscles at the same time to perform complete action. Gain the manner of walking. Relax reflex CBB bellow. Involuntary move, for example, a tino tremor. Here at Trafford Care report about patient with tremor. Case 80 on examination, he faced shower litter or expression. There was a tremor affecting mainly her right hand. She has her hand generally increased muscle tone, power reflex, coordination, and sensation were with the normal limit. Examination of gain showered that she was slow to start walking and had difficulty stopping or turning. Tender reflexing. Examination of nervous system normally include texting tender reflex. For example, the kicking her with a tender hand, hernia, also known as reflex hernia. The reflex may be ascend or disminute norma or print. The plant reflex are also checking the normal pattern response is at the downs going, moving plant reflection of the piston or ongoing to extension or babaking respond a normal. Coma. Coma is consonant with reduced response to external stimuli. Doctors say the patient is in a coma. The patient is comatose. They glass going coma slam scoring is calculated as follow. Enter opening. Is sporneum to spine nona. Orientate, confused, inappropriate, uncompressible nona. Obeys, localize, withdraw, flexion, extension nona. En español, la 26 dice, el sistema nervioso o pérdida sensorial. El sistema nervioso central controla las funciones sensoriales y motoras del cuerpo de enfermedades del sistema que pueden causar pérdida de algunas funciones. Como podemos ver aquí, pérdida de funciones, audición, sordera, vista, ceguera, equilibrio, inestabilidad o ataxia, sensibilidad, adormecimiento o anestesia, pérdida motora. La enfermedad del sistema nervioso también puede afectar el control del motor debilitador de movimiento o causa espasmos. Otros síntomas, zurbido o pitido en el oído o tititu, visión doble, diplopia, visión borrosa, disminución de la agudeza visual, hormigueo, sensación de aguja, parestesia, mareo o vértigo. La pérdida motora. Los síntomas de pérdida motora pueden incluir debilidad, parálisis, temblor. La debilidad disminuye la fuerza muscular, la parálisis, pérdida total de la función muscular, temblor, movimiento rítmico, voluntario, involuntario, específicamente en las manos, mancha anormal, alteración en forma de caminar, afectación del hablar, ronquera, voz áspera o profunda como la parálisis de las cuerdas vocales, hablar arrastrada, dificultad para articular palabras frecuentes como enfermedades cerebrales, pérdida de conciencia. Las pacientes pueden describir una pérdida súbita de conciencia como término desmayo, colapso, convulsión, ataque de epilepsia. Diferencia entre síncope o crisis epiléptica. La principal diagnóstico diferencial entre el síncope es la pérdida temporal de la conciencia por una falla en la circulación cerebral, como al estar de pie, el estrés severo o por arritmia. Puede acompañarse de convulsión y pérdida de control de la vejiga. La crisis epiléptica generalmente por una aura en una señal de advertencia que indica el sistema el inicio de un ataque. The oncology. Neoplasm is an abnormal new growth tissue. Malignant neoplasm cancer are likely to spread and cause serious illness or death. Bigness neoplasm do not spring and are less helpful. When speaking to patients, doctors generally say grow or tumor. You, you have a small growth or tumor in the bowels. A lump or swelling is a condition or tension of fluid when a vision or palpitate can be palpitate or filled with fingers or long maybe during to a neoplasm, but there are others cause some inflammation, fluid, or accumulation. Patient say, I have a lump in my left brain. Doctor say, there was a filled palpitating mass in the liver. Malignant tumors are characterized by rapid growth with invasiveness. The tumor may invade local tissue or spread to distant part of the body. Metastasis. Neoplasms, which are the result of metastasis, are called secondaries or as opposed to original tumor which is a primary. We have the result to can scale by now, and I afraid they show that you have small growth in the prostate. Fortunately, it's appeared to be an early standard. There is no sino spread. So if we remove it, there is every chance a complete cure. No, to invent is a verb, is to enter to spread throughout a part of the body, and this process is invention or noun. Invention is the noun. If I tumor, describe an invention. If I ability to spread symptoms sign of malignancies. The symptoms are malignant disorders by being relaxed to size and localization of the tumor. For example, severe accumulation in the brain cause raise intracranial pressure and symptoms sonagere vomits, a vision defeat, the tuberous tumor of the colon by obstruction below the lumbar cloud chain with power a bit. Other opposite symptoms of malignant include lady pains and weight loss. Cause sweet 555 at 33 years may practice to him GP complain of failing lungs on the region syndrome Hines. We has a big present for about 2 months and Roy Elangi. He has been feeling generally unwell and has lost about 5 kilos in weight. He was also complaining of the nine sweet. It has no significant past and medical history. Screening of tumor. Tumor can sometimes be completely removed or excised by surgery if this is not possible. For example, if we had a real metastasis to other part of the body, it may be possible to destroy it by radiotherapy or by chemotherapy. When a cure is not possible, palliative training is given with its only intent to relieve symptoms. Neoplastia. La neoplastia o oncología, como dice ahí que es la especialidad, la neoplastia es el crecimiento anormal de un tejido. La neoplastia maligna de cánceres son propensos a propagarse y a causar enfermedades graves o la muerte. La neoplastia benigna no se propaga y son menos dañinas. Cuando hablamos con los pacientes y los médicos generalmente usan el término crecimiento o tumor. Tienen un pequeño crecimiento o tumor en el intestino, un bulto, hinchazón o una acumulación de tejido o flujo visible o palpable. El bulto puede defenderse o neoplasmia, pero también hay otra causa como inflamación o acumulación de fluido. Los pacientes dicen, tengo un bulto en el seno izquierdo. Los médicos dicen, había una masa firme y palpable en el hígado. Los tumores malignos se caracterizan por el crecimiento rápido e con invasibilidad. El tumor puede invadir los tejidos locales o propagarse en partes distintas del cuerpo que hace metastasis. Los neoplasmas resultan la metastasis se llaman secundario y oposición al tumor original que es el primario. En caso de los pacientes, los resultados de la exploración muestran un pequeño crecimiento en la próstata que afortunadamente parece estar en una etapa temprana sin signo de propagación, por lo que existe una gran posibilidad de curar completamente. B. Síntomas y signos de malignidad. Los síntomas de enfermedades malignas pueden estar relacionados con tamaños y la ubicación de este tumor. Por ejemplo, una lesión que ocurre en el espacio del cerebro puede causar aumento de la presión intracraneal y síntomas como dolor de cabeza, vómito o trastorno visual. Los tumores de colon pueden obstruir el lumen a causa de los cambios del hábito intestinal. Otros síntomas malignos incluyen sangrado, dolor, pérdida de peso. El caso 55, un hombre de 33 años acudió a su médico de cabecera quejándose de un bulto indoloro en el lado derecho del cuello, que había estado presente durante aproximadamente 2 meses y estaba aumentando de tamaño. Además, se sentía enfermo y en general había perdido aproximadamente 5 kilogramos de peso. También se quejaba de sudores nocturnos que no tenía antecedentes médicos significativos. El tratamiento o tumor. Un tumor a veces puede ser completamente extirpado o extirpado mediante cirugía. Si esto no es posible, por ejemplo, si se llega a propagar en otras partes del cuerpo, puede ser distribuido mediante radioterapia o quimioterapia. Cuando no es posible la curación, se determina un tratamiento paliático que no solo tiene como objetivo aliviar el dolor, que solamente tiene como objetivo aliviar el dolor.